Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Gaulin.
Hey everyone, welcome to today's episode of the Gastro Girl podcast. We're so excited. We have a gastroenterologist from the world-renowned Mayo Clinic, who's also an author. She wrote this adorable and really educational children's book called Boo Can't Poo. Welcome, Dr. Xiaojing Iris Wang from the Mayo Clinic. Welcome. Did I say that right?
You did. And thank you so much for having me. It's been honestly like a goal or a dream to be on your podcast. And so I'm really, really excited to be here. Thank you for the opportunity.
Oh my God, you are so amazing. And so we're so lucky to have you on. And when I saw, I've worked with you, with other things, but when I saw that you wrote your book, I was like, oh my God, this is so great. And, before we get into the book, let's talk a little bit about the topic of the book and why you wrote it. It's for managing constipation in toddlers, correct? Talk a little bit about why this is a big issue for parents and for kids.
Absolutely. I want to start off by caveating that I am not a peds gastroenterologist. I have some really amazing colleagues in peds gastroenterology, and I definitely don't have the level of expertise that they do when it comes to truly managing toddler constipation. But what I am is an adult gastroenterologist, and I see a lot of patients with abdominal pain. And abdominal pain is really my area of expertise at Mayo. And a lot of abdominal pain and a lot of abdominal symptoms that are hard to explain often come down to constipation. And so I spend a lot of time in my clinic talking to patients about constipation. I teach my fellows that constipation is the root of all evil. And we spend a lot of time talking about why people get constipated and their pelvic floors and how to actually poop. And as I was having these conversations with my patients, I was starting to get these looks, and these patients would just be like, well, I never knew that before. How come no one's ever told me that this is how I'm supposed to do it? How come nobody's ever talked to me about, how those over-the-counter laxatives work? And I just started joking with them that, maybe I should write a book about it. And I was a toddler mom at the time. I had my baby my first year of fellowship, and I was spending a lot of time reading all these children's books to him, and the children's book literature was just so full of this educational content now, and I would read him these books about the human body and these books about physics and general chemistry for babies. And I was like, well, there should be a constipation for babies. We should start at the very beginning and teach healthy habits from the start, because a lot of the times these issues are lifelong. And so it started out as a joke, and on, I realized, what's the harm, right? They're self-publishing. I'm a gastroenterologist. Maybe I'll have more of a voice. And so I wrote the book and was fortunate that Mayo Clinic Press picked it up.
Oh, that's great. Did you do the illustrations too?
No, I made these, I had illustrations. They were definitely just kind of like a mock-up and would not be, I would not even show you these illustrations, but they got the idea across of what I wanted. And when Mayo picked up the book, they actually did the hard work of looking for an illustrator, and we were able to find one who really just brought Boo to life.
Oh.
And I think so much of the book rides on these illustrations, and she's just so amazingly talented.
Oh, that's good. So tell us, what, who inspired Boo? Was it your child?
The name, actually, I just was looking for a word that rhymed with poo, and Boo seemed to be a really good one. And with a name like Boo, he was going to be a ghost, right? But I thought about it too. And, having Boo as something that is relatable, but not a human, makes it a little bit more fun. Right, and makes it a little bit more less yucky, because part of the reason for writing this is, as I was talking to other toddler moms who learned that I was a gastroenterologist, they would tell me about their kids and their problems with their bowel movements, and oh yeah, this is an issue, and nobody talks about it, because I think at the heart of it, it's still a taboo subject that's difficult to discuss. And part of the point of this book is to make it more normal for kids to talk about it. And I think that making it cuter, making it a little bit more animated and cartoonish makes it more accessible, hopefully. And someone had pointed out, and I wish I could take credit as my original intention, but someone had pointed out that Boo's transparent. So you can see into his bowels, right? So of course you could see where the poop goes.
Oh, that's really...
Initially, the book was supposed to be a lift the flap book, so that you could like open Boo and see where the poo was going with everything he did. But I think we still get the same idea across.
That's so cool. So what are some of the tips or takeaways from the book?
I honestly, when I first started out, I just wanted to write a book about pelvic floor dysfunction. I just really wanted to write this book to teach people that they were not supposed to strain when they pooped. And I was like, well, that can't be the only point of this book, right? So what are the other big important things that everyone should know? So the book goes over eating fiber, exercising, drinking enough water, and then of course the toilet mechanics too.
And for kids, like, can you read us like a little, like maybe the opening couple pages to just get a sense of, I'm
sure.
So excited to hear this.
I have a copy. So here's Boo Can't Poop.
That's so cute. Aww.
And you know, it's funny because my little son can now recite this from memory.
We should have had him on.
And I'm so proud of him.
We should have had him on reading this.
Yeah. He would have loved it. So here's our first page. Boo the ghost has lost his groove. Boo has a poo and it just won't move. Boo tries to strain and push, but that stubborn poo just won't leave his tush.
That's so cute.
I need help, thought little Boo, so he asks his mom and his dad goes too. Exercise, says his mother, jump or dance or chase your brother. Get outside and kick a ball, moving will speed your colon wall. So I want to point out that, you know, I think I'm trying to send the message to kids that they need to ask their parents, right? They need to reach out for help. And that exercise is not just about running. Like I really am not a big runner. And so I wanted to give other options for moving and really teach kids what these things are doing, right? Exercise is helping move the colon. When we talk about in the next page, eating fiber, you know, it talks about how that's going to help bulk up the stool and how water will make that hard poo really softer instead, right? And so I'm not going to read you the end because there's a little twist, even though it's only 14 pages. But we do have a little point at the very end that goes over all these tips about constipation and what is the fiber doing and you know, what is the squatting position really helping with and why do we lift our knees and when to ask for help.
This is great. You know, I think adults and adults could benefit from this too. You know, they're reading it. They're probably learning something as well if they're reading it to their child. And, you know, the parent can also refer to it if their child doesn't want to drink his water. Well, look what happened to Boo, you know, and show them the picture. Yeah. I think this is so great, Dr. Wang. I'm so excited that you've written this book and the illustrations, they look adorable.
They're really cute.
What else?
And you're like unearthing my secret agenda here, which is actually to get all the parents to read the book too. Because everybody gets constipated, right? And everybody can know a little bit about fiber and about water and exercise.
Well, they'd probably much rather read it in a fun, you know, engaging way that's non-threatening. Like you said, it's a character. You know, that's part of the reason when I started Gastro Girl. It was like this advocate character, cartoonish, that it could be relatable like a superhero. And it wasn't about anyone in particular. And it kind of removes that any kind of judgment or it just makes it more accessible. So I totally get the importance of having Boo as your character that people can relate to. So and I remember that book, Everybody Poops or Everyone Poops. Yeah. That was a kid's book, but I mean, as adults, like I think I got that, you know, as an adult and it was very relatable and everyone loved it. And hopefully this is what's happening with your book.
I mean, I just want to share that like since Boo has come out, it's been about 2-3 weeks now. I have these highlights of my day now where people who've known me from all over text me pictures of their children reading Boo. And they're telling me stories of their 3 or 5-year-olds saying, oh, these are the veggies that Boo said to eat. Or like somebody told me that their 7-year-old say, hey, grandma, you know, sometimes I strain like Boo. And that's just like, I don't even have the words to tell you how amazingly fulfilling that is and validating to hear those stories and just be like, this is the vision, right? This was the goal. And it's one thing for my friends to support me, right? It's quite another for the kids that this was meant for to actually enjoy the book. And I'm so grateful for this opportunity.
Oh, we're grateful that you wrote the book. And also, I know, and let's get on a serious note, the problem of constipation, the incidence of constipation. And I think, and correct me if I'm wrong, you might see this in your practice where adults present with constipation and it ends up being a pattern that they've had since childhood. So, I mean, don't you see adults who've had constipation issues their whole life?
Absolutely. Absolutely. And that was part of the reason too, where especially like I have a particular patient population that sometimes as a doctor, you feel like these are my people, right? These are the people I'm meant to take care of. And I love all of my patients, but this young group of kind of adolescent young adults in their kind of early 20s who've just transitioned from the pediatric world, I tend to get along with them really well. I tend to connect with them because a lot of them have had these issues since childhood, that we can talk about how common this problem is, that nobody talks about it because how it manifests often isn't necessarily constipation. It's bloating, it's pain, it's pain sometimes bad enough to send them to the emergency department, but nothing is ever positive on a CT or shows up on an X-ray. And I think that being able to understand that this is part of the story, that this is an illness story that so many people experience, and being able to share that with these patients is so valuable. And Brennan Spiegel and his team at Cedars-Sinai had done this study years ago looking at what percentage of people actually talk to their patients about, talk to their doctors about constipation. And it was something like 37%. Only 37% of people with constipation ever bring it up as an issue to their doctors, for however many reasons, right? And so kind of being able to empower people to talk about it, but also give them some tools so that they don't necessarily need to talk to their doctors about it, right? You get 15 minutes in a primary care visit, and if you have other things going on, this sometimes falls by the wayside. And it can really snowball and it can contribute to poor quality of life. And hopefully this can prevent some patients from having to suffer with it.
Yeah. And you mentioned two things at the beginning, motility and pelvic floor. And a lot of times, you're right, we've done some podcast episodes on the pelvic floor and constipation with some of your colleagues as well. And oftentimes, like, they're on this, and you know this, they're laxative addictive and they're not having any response. And then there's also underlying issues that could be in the behavioral health realm, whether they had trauma as a child, as an adult, they could have been, PTSD. We're learning so much about the brain and gut and with motility. Talk a little bit about that and what you want patients to know. And I know it's in relation to the book, but I think this is a great way to segue into this important topic.
Absolutely. And I think that I tell my patients often that DGBIs, right, these disorders of gut-brain interaction, I'm biased because that's what I love and I study and I treat, but I tell them that these are some of the most complicated diseases in GI. It's not a diagnosis of exclusion of like, your CT scan is normal, so it's all in your head, so you're fine, right? It's not just IBS. IBS is a term that we're using to try to pull together and collate this group of disorders that we don't have the science to define yet. And we're working on it, right? There's so many amazing minds out there studying the impact of trauma, studying the impact of the microbiome, but these things all interplay and interact and really contribute to this web of cause and effect that lead to these disorders and manifestations. And I think that just because we don't have a CT scan that lights up, right, does not mean that there's less suffering, that there's less truth to the pain that our patients experience. And I want to get that out there, but I know that doesn't answer your question.
No, I thought that's important. This is, we're having an important conversation, and I like where this is going. So please, continue.
Yeah, but to kind of circle back more to your initial question about trauma and the brain gut. And I think that, there's so much out there to unravel. And I want to be careful about labeling things trauma-induced, right? Because that's not what we're trying to do. We're not trying to say that this is a manifestation of anxiety. We're not trying to say that these are somatizations, right? But what we are saying is that these traumatic experiences can certainly lead to a miswiring of our nervous system, can certainly lead to hyper-awareness of symptoms. And I think the one thing that I want to emphasize is that trauma as a construct in this context, right, is not just war, is not just PTSD. It can be medical. It can be medical trauma from an ICU stay. But when it comes to things like IBS, that trauma or inciting incident of our body can be the URI we had, can be the COVID that I'm currently living with. All of those things can trigger our nervous systems to wire the wrong way, can cause our gut bacteria to be out of whack. And so this idea of trauma, I think patients, when we think about the word trauma, sometimes it's a really big word. And people don't want to own trauma because it seems stigmatizing or something else, or maybe that what happened to you wasn't as bad as what happened to the other person. We can call them inciting events, if you will, or risk factors or environmental contributions. But all of them most certainly impact how our gut responds because it's so intricately tied to our central nervous systems.
No, we appreciate how you clarified this. And like you, I'm not trying to label something, but when I bring this up in conversations, because IBS and other conditions are so multifactorial, we want the patients to start thinking bigger than, this caused it. This is the reason. And to have those conversations with their doctor, maybe they're going through a tough time in their life. They've never had this before, and now they're suddenly faced with this issue of constipation, and to make those connections, to help the doctor, get a more accurate diagnosis, to be more open and not be afraid to share facts of your life that you may not think matter, but they possibly could matter.
Yeah. And on the side of the physicians, right, and the providers, we have to know that these things matter, that we have to ask these questions, that we have to understand that life circumstances impact our bowels, and that it is good to ask about them, not to try to explain away the symptoms necessarily, but to explain to the patient and to kind of validate the story. Because I think a lot of patients just want to know why. Like, why has this happened to me out of the blue, right? And one of the most frustrating things for me and for the patients is that I can't tell them that. I can't tell you why this has happened to you. And I'm, it's something that I think that if we can get away from, can move past, whether because we found a reason or because we are on the same page to accept that, we may never know, but it is okay to move forward. It's a pivotal point in our therapeutic relationship that we can move forward.
That's a great point. And, as we kind of round out this conversation, that brings me to the next point, the treatment options for constipation. I know you probably don't get into this in the children's book. You kind of touch on things that we could do, children and adults, hydration, movement, what we're eating, fiber, and all of that. And those are great things. But for those patients that may be facing more chronic and where they need more intervention, like what are some of the options for patients that they should be aware of? And we don't have to go detailed, but just to kind of give patients an overview that there's many things that are out there for them.
Yeah, absolutely. And I'm going to take a brief sidebar, if that's okay with you, to say that like boot camp poo isn't necessarily for people with constipation. It's to prevent constipation. It's for those isolated episodes, right? And so in a shameless marketing ploy, boot camp poo is for all kids and all parents and anybody with a GI tract who might experience constipation, because the point is really to normalize that conversation. It's to get to patients and kids and parents before they need us, before they need a medication. But should they need a medication, I have a lovely table that I go through with all my patients. And generally, I think if we are talking about constipation that you need a drug for, I usually start with polyethylene glycol and something osmotic. I like to start with the over-the-counter medications. I think that those laxatives are really, really effective when you know how to use them. And part of the problem is we never tell anybody how to use them. So I really like polyethylene glycol because it's a powder, and it's very, very titratable, and it's very, very safe. So what that means is you can take this powder and you can take a capful a day, like it says on the bottle, but that might be not enough for some people, and it might be way too much for other people. And I hear both ends of that spectrum. I tried this, it gave me massive diarrhea, I stopped it. Well, I tell them that's great. It worked. It worked so amazingly well. All we have to do is scale it back, because it's a really titratable med. So that's always my backbone to start. A different option, if polyethylene glycol with that powder is not your cup of tea, if you will, is milk of magnesia, which comes more in a liquid form. It's less titratable. You can't control it as well, but it works in the same mechanism. Both of those are going to pull water into the stool to make things nice and soft. Some part of that is going to stimulate movement, but mostly it's going to be to keep the stools in a softer form so they come out easier. And so gentler on patient systems, and they're not going to be running to the toilet. If they need a little bit more, I tell them to use what's called a stimulant laxative. So that medication is going to help the colon contract and really help move things along. Those medications tend to work in about 6 to 8 hours. One of them is bisacodyl. The other one that we like is Senna. I usually have patients take that at night so that with their morning coffee, which tends to stimulate some movement, those two things can kind of augment each other and really help produce some results. I usually have patients take that only on a short-term period and then have them stop after things have regulated. But that if they need something long-term, Miralax daily is really more helpful. And if that combination is not working, then that's when we should talk about pelvic floor testing, seeing a GI doctor, doing a prescription laxative, of which there are many, many good options on the market, or something like that.
No, that makes sense. And I like how you said short term. And again, this is, we don't want people to get in that vicious cycle of continuing to take multiple doses of laxatives, because it ends up backfiring and it makes the situation worse, correct?
It certainly can if we haven't really sussed out the reason, right? And you'll see that a lot of the medications say don't take for more than 14 days without talking to a doctor. And that's not because it's unsafe to take the medications. It's that if you have had constipation that you're not getting checked up, especially if you're older and it's sudden onset, it is actually really important to see a doctor to make sure there's nothing more sinister going on.
Yeah, that's great advice. And even in the book, we're adults, but we can benefit from reading the tips in there to, like you said, prevent this from happening, prevent constipation from happening. Well, this has been such a pleasure, Dr. Wang. Again, congratulations on your book. Are you going to do any book tours? Have you done some book tours, or are we going to see you on? Have we seen you on TV? Did we miss you? Or
I've been on local TV, and we've been hosting a couple of local launch events. So we had a launch event at a local bookstore a couple weeks ago, and this Saturday we'll have one as well at a kids' toy store. More geared towards the little ones that should be reading the book.
Well, this is great. Yeah. And people can get the book on Amazon?
Absolutely. So it's on Amazon. It's on Target. It's anywhere you get your books.
And we'll put a link on our website for folks who want to find the book. And also we'll link to it on our slide in our podcast episode. Thank you so much.
Thank you so much for having me. I really appreciate it.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.